All right, so welcome everybody. We'll go ahead and get started. I am Rachel Flum. I'm the Executive Director of the Economic Progress Institute, and I want to welcome you today to our webinar on the Temporary Caregiver Insurance Program focused on caregiving for a family member. For those of you who aren't familiar with us, we're a research and advocacy organization focused on improving economic security for all Rhode Islanders. I'm joined today by my colleague Linda Katz, who is EPI's Policy Director, who will be providing the details on the program, and also Kathy McEwen, a former supervisor with Catholic Social Services of Rhode Island, also formerly from the Department of Elderly Affairs and a longtime advocate for seniors. Thank you for joining us today, Kathy. And thanks also to Blue Cross Blue Shield of Rhode Island, who provided funding to support today's webinar, and to Age Friendly Rhode Island, especially Maureen Magritte and Karen Menzel, who have helped both prepare for and spread the word about today's webinar. Thank you, ladies. We also want to acknowledge the Rhode Island Department of Labor and Training, who are helpful partners and always willing to answer questions for us. So with that, let me just do a few housekeeping details. This webinar will be recorded, and we will share the video and copies of the slides with you all tomorrow. And either later today or tomorrow, we will also post the slides and the recording along with other materials on our website at www.economicprogressri.org/TCI. And I'll share that later in the slide deck so that you can share this webinar with folks that you know that might be interested. You are all on mute, but we welcome questions, and you can type those into the question box on the right-hand side of your screen. We will have ample time at the end of the presentation to answer them, but feel free to type them in when they come up, and if it's something that relates to a slide, we may intersect and answer it. If you're not able to type questions or you have other technical problems, please email our communications manager or give him a call. His name is Juan Espinosa. His email is jespinosa, with a Z, at economicprogressri.org, or you can call him at 401-456-2752. Lastly, if we don't get to your question today, we can always respond with a follow-up email, especially if it's very technical and we need to check with DLT. We will follow up afterwards. So with that, I'm just going to start with an overview of the program and then turn it over to Kathy to help provide some context. All right, let's see if I can get these to go. Here we go. So the Temporary Caregiver Insurance, or TCI, is part of the Temporary Disability Insurance Law in Rhode Island. TDI has been around since the 50s and is a long-standing program that many people have paid into. TCI was passed in 2013 and became effective in January of 2014. It's available to employees who pay into the TDI fund, and Linda will get into who those folks are in a minute. The TCI program provides wage replacement benefits for up to 4 weeks in a 12-month period, which enables workers to do two things: either bond with a child, either a newborn, adopted child, or a foster child, or to care for a seriously ill family member. Today's focus is on the second part of those categories, caring for a family member. So here's just some quick 3 examples of who might need to take TCI. Juan cares for his elderly mother who has Alzheimer's and does not speak English. His mom recently had a stroke and had to be hospitalized. Juan needed to be at the hospital to help ensure his mom receives the care she needs and then for her transition home. Or Jennifer's son has a serious mental illness. He has been doing well with medication, but recently had to be admitted to Butler Hospital. He is going to be released soon and needs someone to be with him until he is fully stable. Jeff's young son has severe asthma, which sometimes flares up, requiring hospitalization and home care. So with that very brief overview, I'm going to turn it over to Kathy, who will help set some context, and then Linda Katz will provide the details of how the program works. So let's see, technology-wise, I can hand it over to Kathy. Give me 1 second. Okay.
Okay, well, thank you, Rachel, and thank you, Linda, for having me here today. And as Rachel said, I'm going to give you a little context about why this is such an important issue for those of us who care for older Rhode Islanders. Just quickly, we have about 178,000 people over 65, 57% women, 43% men. One of the statistics that I like to point out for Rhode Island is that we do have not the highest number of people, but certainly the highest percentage of people age 85 and over. Now, this is very telling for needs for care going forward. It's usually the old who have some medical conditions or some limitations that would require caregiver assistance. 40.5% of people 65 plus do have multiple chronic conditions, 32% some type of disability, and 10% are going to experience a fall. Almost half of our older households 65 plus live alone. Again, a statistic that's important for people as they age. Who's around to help them out when there is a need? And 34% of older households have income less than $25,000 a year. That factor alone is a real red flag for the aging population, the 85 plus, those who are going to need some help and some care. Studies that are being done about caregivers always point to the fact that it costs caregivers money to help people out, and certainly care as we get older involves a lot of cost. So that's a factor that we need to keep in mind. All right, why is the TCI program important for the caregivers of older adults? Many people are helping older adults in Rhode Island to remain independent, to stay in their own homes, to live a life with some quality in their later years. But it is complicated. Care for older people is complicated. So you have hospitalizations, ER visits are more frequent for older adults, and they may lead to placement in rehab, transition home from hospital after surgery. This can be 3 to 6 weeks before people are really back to full activity, or even 10 to 12 weeks. And older adults often need assistance and care during this recovery. So who's helping to select post-acute care providers, follow-up visits to physicians, transportation of someone who is in rehab or needs medical care is always very complicated. And we rely a lot on family members for all of this kind of help. You know, there's that expression, it takes a village to raise a child. Well, it certainly takes a village to provide quality care and independent care for people in their later years. And as my mother used to say, everybody needs that bossy daughter, the one that can be with them to go to the doctor's office or to get the list of what has to be done at home before discharge. But most of us are working. Most of us in that age group are working. So how can we be there to help someone else? And that's what we're talking about today. And then TCI, keep in mind, is just one small piece of the whole picture. We're going to talk a little bit later on in the webinar about other services that can be brought into effect to help people out. But for the caregiver who is a working caregiver, the average typical caregiver is a woman age 49. So we're in the realm of people still working and usually caring for another woman 69 or over. They're providing care an average of 4 years, 24.4 hours a week. Well, if you figure in how much time you're working, if you have your own children to deal with or grandchildren, and then you look at another 24.4 hours helping with ADLs, which are activities of daily living, those basic things we all need like bathing, eating, dressing, or the IADLs, which are the incidental activities of daily living, running the errands, transporting, keeping up the house. How much time is left after you look at all of these tasks and at the person who's working as well? So there's all of that to take into account. Typically, a caregiver is employed full-time, likely married or living with a partner with an average household income of $54,700. That's not a person who can say we can afford to buy as much care for mom as we need, bring in as many people as we need to have in the house all day long, 24/7. These are people who are living on budgets and are are juggling so many other responsibilities. When I first started working many years ago in the field of aging, we talked about the sandwich generation, the adults who had children they were still raising, but parents they were helping to care for. But now we talk about the club sandwich generation, because people are living much longer. So now we're talking about people who are maybe not quite retired yet, but are dealing with their parents' issues, have adult children that are still asking them to help out with the grandchildren. So those people that are caught in that people who are caught in that caregiving mode are really, really in demand and very much needed. So now how can we help? What is this TCI all about? I'm going to pass the microphone over to Linda Katz, and she's going to walk you through exactly how it works.
Thank you, Kathy. And those data are really important as we continue working together to improve the ability of people to age in their home. And TCI is certainly an important part of that, to allow family caregivers to do what they need to do to take time from work to be able to care for a spouse, a child, or elderly parent. So we're going to go through the basics of eligibility for the TCI program. We're going to talk about who is eligible for the benefit, people who pay into TDI, they have to meet the earnings requirement and meet the caregiver requirement. We'll go over that. We'll talk a little bit more about how much does somebody receive when they're taking TDI. It's 60% replacement of wages, and there's a payment for dependents. Benefits are available for up to 4 weeks in a benefit year. And an important part of the TCI law is that a person who takes leave for caregiving or bonding is entitled to return to their same job or to an equivalent position. And finally, we talk about the process, sort of 2 parts of the process. One is notifying the employer that the person is going to take TCI benefits, and the rule is to inform the employer 30 days in advance of taking time with a written notice, but there is a provision for waiving that 30-day advance written notice in unforeseeable circumstances. So for example, if a person knows that mom is coming out of the hospital in 2 weeks, that person would give advance written notice to their employer as soon as possible. But if spouse is hospitalized in an emergency circumstance and the other spouse has to take time off right away, then that would cover eligibility for being able to qualify for TCI. And then we'll go over a little bit in more detail the application process with filing the application with DLT. So first, who is to be eligible for TCI? A worker has to be paying into the TDI fund. And you would all know whether or not you've paid in, because there's a little deduction from the paycheck. As Rachel mentioned, workers are the ones who pay for both TDI and TCI. So there's a deduction from the paycheck showing Rhode Island's payment into Rhode Island's TDI program. So that's one, paying in. All state employees and most municipal employees are not eligible for TCI or TDI because they don't pay into the fund. And if somebody is living in Rhode Island but works in Massachusetts, they are not going to be eligible because they're not paying into the fund in our state. Conversely, if somebody lives in Massachusetts and works in Rhode Island and has been paying in, they would be eligible for benefits. The next requirement is to meet the earnings requirement. And the amount that one needs to earn to qualify for TCI changes every year. Currently, the person has to have earned at least $12,120 in the base period, or there's an alternative base period to protect people's access to TCI if based on what they've earned closer to the time of needing to take the benefit. So The base period is 4 of the last 5 quarters before starting the claim. For example, if a claim is filed in May of 2009, this is the second quarter, so the quarter being April through June 2009, and the base period would start in the prior quarter, January through March 2009, and then look back 4 quarters in calendar year 2018. So the earnings of $12,120 would have to have been made in 4 of those last 5 quarters. I'm not going to go into the details of the alternative base period, but just to know that it looks at earnings in the 4 quarters just before the person is filing their claim. So we know people have to pay in. The second requirement is caring for a family member, and these are the people who are currently considered to be a family member. A child, so caring for a child, including a foster care child, spouse, parent, parent-in-law, grandparent, and domestic partner for same-sex couples. And it's caring for one of those family members who has a serious health condition, which is defined as having an illness, injury, impairment, physical or mental condition that involves inpatient care or continued treatment or supervision by a licensed healthcare professional at home. And the licensed healthcare professional includes physicians, physician assistants, nurse practitioners, surgeons, psychologists, psychiatric clinical nurse specialists, licensed clinical social workers, licensed independent clinical social workers, LICSW. And this is also the list of individuals who will fill out the medical form certifying the need for caregiving. So that's the eligibility to be able to qualify for TCI. Now let's look at what is the benefit that's paid to the eligible worker. As I mentioned, the wage replacement is around 60% of wages, and there's a dependent benefit. There is a maximum and minimum amount of TCI that is paid. And again, like the amount to trigger eligibility, this amount changes yearly. It's currently a maximum benefit of $852 and a minimum benefit of $98. And then there's an additional dependent benefit for up to 5 dependents, which is defined as a person under the age of 18 or 18 and older and disabled. And the dependent benefit is $10 per dependent, or 7% of the employee's benefit rate, whichever is higher. Under the TDI program, which is what we can take if we're disabled and need to take time from work, taxes are not taken out of the TDI payment, but taxes are taken out of the TCI payment. So it's not the gross pay that the person's receiving, but rather the net with taxes taken out. And as we'll talk at the end, there are efforts to try to increase the wage replacement amount, because it's clearly very difficult for a worker with lower income to live on 60% of his or her wages, and that impedes people from being able to take this important benefit. Okay, so we know who can qualify for TCI. We know how much people will get. Now, the benefit is available for up to 4 weeks in a benefit year. And that benefit year begins on the Sunday of the week in which a person is unable to work. And the benefit needs to be accessed in weekly increments. So it can't just be, I'm going to take this day out. It has to be that the person is going to be out for a full week. So as an example, the person leaves work on Tuesday, May 7th, 2019, and the benefit year then runs from May, the previous Sunday, to May 4th of 2020. And any time in that 12-month period, the person can take those 4 weeks of benefits. So that might be the person needs to take them consecutively to address a serious illness, help a family member with a serious illness, or it could be they spread it out over the year because they know that somebody's going to have has a chronic condition and they may have to take time out over the course of that 12-month period. So now let's start looking at the application process. There are 3 ways to apply for TCI online, and it truly works online, or to download an application from the website and mail it back to the TDI office at DLT, or to request an application by phone, and we have the phone number here, and then mail that back to the TDI office. The applicant has to be out of work for 7 consecutive days to apply for benefits, but the coverage will go back to the date of taking leave. And importantly, the application has to be filed within 30 days after the first day of taking leave. So let's look at all these pieces together. My parent is returning from rehab following hip surgery on Tuesday, May 7th. If I can, I'm supposed to give written notice to my employer by 30 days previously, which would be April 7th. So if I know that that's when mom is coming home, I would want to do that. Then I submit my application for TCI on Tuesday, May 14th, which is 7 days after my first day of leave. And I have to have it in no later than June 6th, which is 30 days after my first day out of work. My payment will go back to May 7th. I'll only get a partial payment for that week since I wasn't out the whole week. And then I can take another 3 weeks off, either consecutively, so I could stay out through the end of May if that's necessary, or I might take 2 weeks to be at home, knowing that in another month or so, I may need to be home again, helping to care for my parent. This is a copy of the part of the application for TDI and TCI. It's all one application, and there's a section specifically for temporary caregiver insurance. You can see here that if you're caring for a family member, you can designate the date that you want your claim to begin, and the date of this application has to be no later than 30 days after the start of the claim, as we've just discussed. If you skip down, you can see that you provide the name of the person you are caring for, and then define the relationship between you and the care recipient. That's all one needs to fill out on this part for caregiving as opposed to bonding. So once the application is filled out, the person submits the claim. When TDI receives it, they'll first look to see whether the applicant meets the earning requirement, that $12,000 or a different figure for claim file closer to submitting the TCI application. If the person doesn't meet the earnings requirement, then they get a notice telling them that they're not eligible, explaining why they haven't met the earnings requirement, and the person can appeal. Assuming that the earnings requirement is met, then TDI will send out to the claimant a notice of receipt of the claim, a medical form to give to the family member's healthcare provider, and then also a notice to the employer, that should say employer, not employment, to document the last day of work. When all the information is back at TDI, so the medical form from the family member's doctor, and the documentation from the employer that the employee has taken leave, then payments will be processed. It usually takes 3 to 4 weeks from filing the application to actually receive a payment, although that can happen more quickly if the materials are provided sort of on a fast track by the claimant. Then the individual would receive a PIN number, the benefit amount determination, and a form to fill out when the person goes back to work. There are 2 ways to get the payment, either direct deposit to a bank account or an electronic payment card, and those forms are part of the application. If the claim is denied, then the claimant may appeal to the Board of Review at DLT, and there's information about that both on the DLT website. The last piece would be that once the claimant is going back to work, they submit a return of work form, either by calling the IVR system, emailing or mailing the return to work form to DLT. There are really good websites. The DLT website has a lot of good information about both TDI and TCI with some very clear frequently asked questions and other information. And there is a Rhode Island paidleave.net website, which was developed by some advocacy organizations and that we maintain now at the at EPI, that has updated information, brochures, and as well as posters to be able to download, and good information about eligibility for TCI. You can find both the presentation today, the webinar recording and PowerPoint, fact sheet on legislation that Rachel will be talking about in a couple of minutes, and a new caregiving brochure that we recently put together that's available in both Spanish and English. It's one brochure, double-sided, Spanish and English. We hope that that's going to be widely distributed so that more people can know about the availability of TCI. Okay, we were just pausing for a minute to see if there are any questions. So I'll just remind you, if you do have questions, please type them in and we'd be happy to answer them. I'm going to bring Kathy back to talk about some of the other activities that are going on and information and tips for family caregivers.
Thanks, Linda. So as I mentioned earlier, there are lots of pieces that go together in terms of taking care of someone. And some of them are pretty obvious and some are not. But one of the things that I would encourage people to do is to just reach out and be aware of any kind of resource that might be available if you are a caregiver. Now, on the slide that we've provided, you see there's an AARP caregiving resource website that you can log on to. AARP has been doing some wonderful work in the area of caregiving. They have lots of resources available. Pretty much, if you are sitting at home thinking, I wish there was a checklist for before I go to the doctor with mom, or I wish there was a checklist for this or that, you can probably find it out there. So I would start with AARP. They have wonderful tools. There's also a family caregiving video series that can be very helpful and very practical in terms of some of the skills that you may need for working with the person that you're caring for. Nationally, there's a Family Caregiver Alliance that provides lots of resources. And locally now, we have a Family Caregiver Alliance of Rhode Island. It is housed and sits in the same building as United Way and La Pointe. And they are developing a focus on caregiving that is across the lifespan, meaning caregiving of persons of any age. We have some other resources in Rhode Island that are particularly interesting. If you flip back up to the top of the slide, the Home Modification Grant Program, which is only a couple years old in Rhode Island. This provides grants for folks who have to make modifications to the home to accommodate someone with a disability. It's a fairly reasonable income limit, and on top of that, it pays for up to half. With a maximum, I believe, of $5,000 per grant. And I've known several people who have been able to use it for those to modify a stairwell with the chair that goes up and a ramp in the front and that kind of thing. So it's a very, very good program and available to those of us in Rhode Island. The other thing I want to mention too is that there are some good resources out there. If you're not If you're not familiar with the Division of Elderly Affairs Pocket Manual of Senior Services, that's available annually and is updated pretty frequently. In addition, I would also, for those of you caring for someone with Alzheimer's disease or related disorder, recommend highly our Rhode Island chapter of the Alzheimer's Association. If you've got a paper and a pencil, I'll mention a couple of phone numbers in a minute. But the Alzheimer's Association has tons of resources for caregivers and also has a very robust caregiver support program. We haven't mentioned anything about that kind of support yet, but for caregivers caring for anyone on a long-term basis, it's wonderful to have somebody going through the same thing that you can talk to. The Alzheimer's Association Rhode Island has done a great job in bringing together support groups for people to talk about what it's like to be caring for someone with dementia or a related type of dementia. So those of you who have pens and papers in front of you, the Alzheimer's Association you can reach at 401-421-0008, or of course you can go online and just Google Rhode Island, Alzheimer's Association. I also want to mention the point. The point is exactly what it says it is. It's a central point for calling in the state of Rhode Island in regards to elder services or services for people, adults with disabilities. Each state now has a similar program mandated by the federal government. In Rhode Island, we call it The Point. I'm going to give you that phone number as well. It's a good starting point, no pun intended, but it's a good starting point if you're just beginning your caregiver journey. You're not sure where to go. You don't know what services are available or how to get in touch. It's a great starting point for that kind of referral, as well as if you've got something specific in mind. So the point is, again, 401-462-4444. So let me repeat those two numbers again. Alzheimer's Association, 401-421-0008. And Rhode Island's The Point, 401-462-4444. And the last phone number I'm going to kind of toss out to you is our Division of Elderly Affairs, which of course is our state agency with a primary focus on those who are 60 and over and adults with disabilities. Again, another good starting point. If you're not really sure, does Rhode Island have a program for X, Y, or Z? Is there a resource for this? You can always get started at the Division of Elderly Affairs, and their phone number, 401-462-3000. Lastly, I want to mention one other thing, healthcare. Healthcare has gotten so complicated. And as we get older, and I speak from personal experience, I hate those things that come in the mail. There's more and more stuff. There's more things to know about. There's something you're always having to learn. But one good thing about the way healthcare is evolving is that some people have healthcare that involves some extra benefits that can help if you're caring for someone with a chronic disability or even a temporary kind of situation where a lot of care is needed. I'm going to mention one. So for instance, there's an accountable care organization called Integra in the state of Rhode Island. If your doctor or your primary care practice or your surgeon or whoever you're dealing with, for the person that you're caring for, if they're a member, they're going to get some additional benefits, some of which could include visits to the home for case management and evaluation. So know a lot about the healthcare insurance that the person you're caring for is enrolled in. There may be some extra benefits for them during a crisis time or during a transition time. Find out about it. I know it's like another job learning all this stuff, but that can be a help as well.
Great. So thank you, Kathy, for all of those resources. And we just have one question that Denise has asked that I want to answer live. So Denise asked, if someone is working and meets the criteria and also has some self-employment income, is the applicant able to receive this benefit and continue to work a few hours total in the 4 weeks period to maintain the self-employed business? So the answer is yes. There's no reason why that person wouldn't be able to continue to do their self-employed work on the side. We are working on legislation to allow self-employed individuals to pay into the TCI program and then be able to access the benefits. But right now, that person would just be able to count their employment at a organization or a business and not the self-employed income until that time, but they could continue to work. Okay, so I just want to take a few minutes to talk about the legislation I just mentioned, that because we hear from a lot of people that the number of weeks to care give is not enough. So as Linda went over, the program right now allows people to take up to 4 weeks in a year, but we know that sometimes our ill family members need longer than that, or may need different periods of time over a year that amounts to more than 4 weeks. Rhode Island was really a leader in passing paid family leave in 2013, but now our other states are catching up. So Massachusetts is implementing paid family leave this fall, and we expect that Connecticut will also pass paid family leave this legislative session, and both of those states have much more weeks of leave available. So here in Rhode Island, Senator Golden and Representative Blazejewski have legislation in this session that would increase the number of weeks from 4 to 6 weeks in 2020 and then 8 weeks in 2021. It would also expand the definition of who you could take time out to caregive for to include grandchildren, siblings, and care recipients. We know that often older adults, the only family members they have left may be their siblings, and so we want to include that option for folks. And 2 years ago, Rhode Island passed paid sick leave, which allowed people to take individual days off work in order to take care of themselves or a family member. And the definition of who you could take time to caregive for was defined as care recipient. And so this legislation would mirror that definition because we recognize that today's families are not all one size fits all, and it may be that you need to take time to caregive for someone that you have responsibilities for that may not be directly a member of your family. This legislation would also increase the benefit amount. As Linda went over, currently when you're out on leave, you receive about 65% of your wages. We know that especially for lower income individuals, they are often paying into the program, but because their wages are low, they're not able to take time off and only receive 65% of their already low wages. So this would slowly over time increase the amount of wage replacement up to 65 in 2020, 70 in 2021, and 75 in 2022. We would also, as I mentioned, like to expand the universe of people who can take time off to include self-employed individuals. We know that there are a number of people in the state who may have even paid into TCI, but then are not, then leave their place of work and may be self-employed, but no longer able to take time off. And so we want to allow those people to be able to pay into the program for a period of time and be able to take leave. And finally, as Linda mentioned, Rhode Island's program was particularly important in that it required employers to not fire. There was job protection. So essentially, if you take time off to caregive, you have to be able to come back to the same job that you had when you left. That was extremely important, especially for lower wage workers. But there are not sufficient teeth to make sure that employers are protecting those jobs. So this would just institute some fines and penalties to make sure that DLT has the resources it needs to be able to go after employers who are not providing that protection. So let's see, I think we have a question about Paid sick time, can you get TCI if you're using sick time to care for the person? Or is it after you exhausted sick and vacation time? So that would depend on your employer. I mean, essentially, if you are paying into TCI, you should be able to take it. The difference is, so they're two different programs. So paid sick is for either emergency kinds of situation, if you've come down with a flu, if your child breaks a leg and you need to take them to the doctor, or if they throw up at school and you need to go pick them up. It is more sort of urgent need. The TCI program, you have to have been out of work for 7 whole days. So presumably, if you had a situation where you needed to take both, you may have used your sick time for those first 7 days before you can file for TCI, and then you would take your TCI leave. I do not think there are requirements that you have to have used one up before the other. So that may be up to your employer, but they cannot forbid you from taking the TCI as long as you meet the requirements of the program. Okay, let's see. I can't make the screen any better. All right, I think that's all the questions. Hold on. So we just wanted to end with a story that we really think exemplifies why this program is important. And I'm just going to read it for everyone and then encourage you all, if you have your own stories or if you were working with families that have their own stories, that these are really effective in helping legislators understand why the program is important and needs to be continued and further improved. So we would urge you to share stories like this that you come across. So Joellen was kind enough to share her story with us. She is a resident here in Providence. And she says, without the TCI program, I would have resigned from my job. My late husband, a Rhode Island physician, was seriously ill and, sorry, I can't see the screen, was seriously ill for 10 years. And nothing in his many decades of medical work and in my more than 25 years of healthcare management experience could have prepared us for the challenging role of patient and caregiver. I honestly could have used a full year of TCI to support after my husband returned home following a fall at a skilled nursing facility stay, but I am grateful for the 4 weeks that we received. She goes on to say, he came home in a wheelchair and I had to rush to install a ramp, grab bars, and other safety devices. We used the 4 weeks to transition to an even more challenging level of existence that never improved again. He and I needed that 4 weeks to organize his space, work with our wonderful and supportive home care agency workers, and try to gather some strength for the short time that remained for us to be together. So these are exactly the kinds of stories that show why people need time to take off of work to caregive. There may be very similar stories or stories that are slightly different, but these are really important to share as we go forward. So again, just to flip back to the website, this is our website, which has all of these materials and also has information about how you can share stories and how you can become engaged in the legislative advocacy if you're so interested. Both of the bills that I mentioned have not had hearings yet, so there will be opportunity for folks to come to the State House and tell their stories and to talk to legislators about why it's important. So if there are no other questions, we just want to again thank both Blue Cross Blue Shield for the funding and thank Age Friendly Rhode Island for their support and for their participation in this webinar. Thank you again to Kathy for participating with us today.
Thanks for inviting me.
And if there are any other questions, feel free to email us separately and stay connected with us through any of our website or social media. All right, and with that, we'll sign off. Thanks so much.